What would you say are some of the common misconceptions about natural hair regrowth?
I love this question because what I always hear is no, but you know what? It's just genetics. I have my mom that is almost bald. My dad has been bald since he's 40 years old. And I'm just going to be bald when I get older because genetics say so. And what I want to say is just because you have the gene for it doesn't mean that it has to express.
Mm.
As I was saying before, same thing with type 2 diabetes. My dad had type 2 diabetes, but as I'm managing his healthcare and I'm giving him herbs and I'm helping him with his diet, he is no longer expressing with typical diabetic symptoms because his glucose level is below 120 in a fasted state, which means he's typically not diabetic. So we manage that with lifestyle change. We can do the same with hair loss. And the way that that looks like is if somebody is presenting with a lot of hair falling out, for instance, if you're a female, the first thing I would be thinking is, do you have any allergies in your home that could be making you sick? Is there an exposure to mold? Is there an exposure to dust? And do you have feathers in the pillows, in the comforter? Because those things degranulate into dust. And also, how old is your home? Do you have a home that is under a construction code that favors saving energy versus your health? Because what they're doing as of late is they're creating homes that are more airtight, and it makes it so we're living in an airplane and dust is accumulating and there isn't, healthy airflow, and we're exhaling out carbon dioxide and it's not leaving the home, or, we're cooking and we're not turning on the vent. And so our homes become more toxic. And so that is another problem, even on top of the allergies, right? So that is something that I would say is to be thought of, to be managed in someone who's trying to be healthy overall, but especially if you want to grow healthy hair. It's not just genetics. It's not just hormones. For people that are thinking, oh, I have DHT that's elevated. I had blood work that showed that I had that. When I looked at, it wasn't blood work, it was a saliva test. When I looked at the patterns of my hormones, it showed that I had elevated DHT. But I also had estrogen dominance because of how little I was producing progesterone in relationship to estrogen, even though my estrogen wasn't necessarily as high as I wanted it to be. And that's the thing. A lot of women have estrogen dominance, but they have low estrogen. And it's just possible because estrogen dominance is categorized by the relationship between estrogen and progesterone. And so in those two instances, we would say, could this be a genetic thing? Right? But if someone has, for instance, high DHT, new science is extrapolating that potentially the reason that's happening is because DHT is a form of testosterone that cannot be broken down into any other hormone. When we create hormones through the process of aromatization, our hormones can be broken down into different types of hormones. But if it's DHT, it won't be broken down into anything else. It's true testosterone. And so testosterone has the ability to be an inflammatory modulator. So could it be that someone is chronically inflamed and they're using excess DHT to help their body deal with that inflammation? And new science is even saying that it's not essentially the DHT that's causing the miniaturization. They're starting to extrapolate that it's more a correlation versus the cause, because they're noticing that prostaglandin D2, which comes onto the scene with DHT, is what is causing that constricting effect, which prostaglandins can do that. They can constrict or contract in an effort to help you heal. And so they're finding that that's actually what's causing the miniaturization to happen. But so that in that case, if we can create a body that is able to be in the parasympathetic state more often, releasing healing hormones more often, if we can create longer periods of fasting, if we can incorporate